Hi, I'm Larry Hopper. I'm Assistant Director of Respiratory Therapy at Baptist Memorial Healthcare, and I'm here to talk about smoking cessation. We actually have a lot of people that smoke in our community. A lot of people still smoking in the country, and it's one of the major, still the primary cause of preventable deaths in our country today. Vaping is just another way of smoking. I think people think that vaping is something that you can do as an alternative to smoking or a safer alternative, and it's really not. I think it's just another connection to cause people to be more addictive. It's another connection to cause people to not to cope with the issues that they have to cope with, so they look for an alternative way of smoking. So it's really basically the same, has the same effect. It's addicting and it can be harmful to people's lives. When someone smokes the body is made, the lungs are made to receive oxygen, 21% oxygen, and not to receive anything else. We weren't made to breathe in other substances outside of air. So when we start to introduce other things into our breathing, it has an abstract effect because we're not made for that. So smoking is all the carbons and all the things that come with smoking that you inhale from a cigarette are things that can be harmful to the body because they eliminate your ability to oxygenate your body correctly. It also introduces carbons and poisons and things like that and toxins that are in cigarette smoking or vaping as well. There are a lot of preservatives that get into your body and can cause the harmful effect to your health. Overall, in maybe a short term, it can cause issues with breathing, but in the long term, the long-term effect is very negative for most people. Our conditions such as obstructive lung disease. Being a respiratory therapist, we treat quite a few patients that have obstructive lung disease, such as emphysema, COPD. We also have some people that have issues with lung cancer. Later on in life, if you smoke for long periods of time, it kind of increases the risk greatly to have lung cancer, to develop nodules in your lungs because of the smoking situation that you did maybe 20, 30 years ago. So we try to get to people early so they can prevent the smoking game at an early age so they don't have to go down the line and end up having an issue. It also can cause secondhand smoke issues. In other words, family members can actually have a harmful effect of smoking in their life as well. There's really not a safe distance from if you're around someone within, in a room with them smoking or in a bar or even in big venues such as football games, basketball games, all those things can cause you to be harmed by that. It depends on the number of people smoking, of course, but also how close you are to them. But relative to distance of smoking, I think really it depends on how a person's breathing. You could eliminate that by making sure that no one smokes. The misconceptions of vaping is that they feel that it's cleaner because it doesn't have the carbons in the smoking as well. It also, misperceptions are that it gives the same amount of nicotine that a cigarette does. Vaping actually can give more enhanced nicotine. It can give a higher level of nicotine. The preservatives that's in the fluid and the liquid that they sell for people to use in the vaping devices or the e-cigarettes, so to speak, you're exposed to whatever those preservatives are. If there's poisons in those, if there's different metals can be in some of the liquid vaping that people use, the liquids that they vape, and you're exposed to that particular part. And whatever they want to put in it, the manufacturers have put things into the liquid to cause an issue with kind of create the same effect that cigarettes would. But those ingredients in that vaping, in the vaping liquids that we utilize, can be very, very harmful to the system because once again, you're not supposed to introduce things to your lungs except 21% of oxygen. Usually that's the norm. And we've gone so far from that by using tobacco smoking or cigars or even vaping. So one of the things you're at the liberty to do is when you buy something over the counter, it could be preservatives in it that keep it sitting on the shelf for long periods of time. They use different toxins or they use different chemicals to preserve the liquid. So you're inhaling all of those preservatives as well. There's lung tissue damage done by vaping. There's also the concern of the actual e-cigarette device catching on fire. And the main thing is that the lung issues that you can have with vaping are very similar to what you can have with cigarettes. You can end up with COPD, or you can end up with an addiction that you really can't get rid of because again, they can increase the nicotine level in vaping more so than they do in cigarette smoking. And the other thing about vaping is we've been doing it for a short amount of time, not a length of longer time, like the length of time that we've done with cigarettes. So really you don't know from 30 to 40 years from now the effect that vaping is going to have on individuals that are now 22 years old. So when they get 60, we know what cigarettes did for someone that started to smoke at 16 and they got to 68 years old and then they end up with lung cancer and things of that sort. So their life expectancy gets shut down, even down to the point that you could be from 22 to 50 years old and have lung cancer. We know that in about 30 years, all of those preservatives and all of the toxins and all of the ingredients from vaping will have an effect probably on the individuals that are using vaping devices. So the effect is going to be just as harmful. It's not knowing the future is the scary part, but we know that anything that's geared toward bringing to your lungs outside of regular oxygen it's probably not going to be safe for you. Anytime you want to quit, you can. It's just a decision you need to make. And don't think that you can't quit. One of the things I hear people say is, I really can't quit because I got this stressful job, or have this stressful family, or have this stressful situation in school. Those are just things that you're using as excuses to not quit. Once they learn that they're making more stress by smoking than they were without it, then you know that it's a decision that you can make. But it's just a decision. And then tell yourself the thing that you need to say to yourself when you get ready to quit is that I can, and I now know it. Because with every experience that we've had, we get better. And I think that's one of the things people don't know is when you do stop the smoking game, you're better than you were before you started.